Okay, I think we'll make a start. Just to remind everybody that this meeting is being recorded, but we're only seeing panelists on screen. We can't see any participants. So thank you very much for coming today. This session is about the pilot placement program. Pilot placement program is part of the Lived Experience Career Compass. So Lived Experience Career Compass sits with Mind Australia. We're a community mental health organisation. Izzy, can you go to the next slide, please? Thank you. I'll talk a little bit more about the placement program. Obviously, that's what the session's about, also where it sits in Mind Australia, and do some introductions. But first, I'd like to acknowledge that Aboriginal and Torres Strait Islander peoples are the traditional custodians of the lands on which we work, and we pay our respects to their elders past and present. Recognise the intergenerational impact of the history of invasion, dispossession and colonisation, and we are committed to the recognition, respect, inclusion and well-being of Australia's First Peoples. I'd also like to just do a lived and living experience statement, very relevant for this space. So at Mind, we value the expertise and leadership of people with personal lived and living experience of mental health challenges and alcohol and other drug use, and family and carers, as we work together to influence and transform the services and systems in which we work. Thank you. So hi, as I mentioned before, I work for Mind Australia, and my role is the Lived Experience Early Career Compass Lead. Career Compass is a program at Mind Australia that oversees 3 early career programs. So the Locals Early Career Program, the Peer Cadet Program, and also this program, which is the Pilot Placement Program. I use she, her pronouns, and I've been working with Mind Australia for 7 years now. My role is a designated lived experience role, so I draw upon that those values and that framework to inform the work I do. I will quickly pass over to Izzy, who can do an introduction for herself.
Thanks, Lisa. So, hi everyone. My name is Izzy. I use she, her pronouns, and I work with Lisa on the Lived Experience Career Compass as the Lived Experience Project Officer. I am also in a designated role, and I've been with Mind for just over 2 years now.
Thank you, Izzy. The other person on our team who doesn't work on a Tuesday, but that is Jacinta, and Jacinta is our project admin officer. So if you do take part in the pilot placement program, it's possible you'll hear from Jacinta with any sort of queries, questions you might have. We've also got there a little link, and we can share these slides afterwards, which we will do, but there's a link there as well to our web page where we have more information about the student pilot placement program. Also on that web page, there is information from each of our 5 partner organisations as well. So whilst they'll be here today to talk to that, you can go to the web page and read all about the different placements they have on offer and the requirements for those placements as well. Thanks, Izzy. So I'll go through who our partner organisations are, and then we will talk about the actual, I guess, how the pilot placement program works, how you apply, and all those sorts of things. And then we will pass to each of our partner organisations to have a chat and do a little presentation on their organisation and the placements that they have to offer. So this section is less of an intro, more of an oversight of who will be talking today. So we have, the pilot placement program, it's a state government funded program, and it's delivered by 5 organisations, which is coordinated by the Lived Experience Career Compass, so Izzy, myself, Jacinta. Our partner organisations are Eastern Health, and at Eastern Health we have Zoe, Eleanor and Ben, and we have Ben representing Eastern Health today. Eastern Health offers placements within more clinical services, and those placements are only open to Swinburne and Box Hill TAFE students. We also have Danny here from Nemi, who will be talking a little bit later, so welcome, Danny. From Origin, we have Darby. Um, Hi, Darby. From Uniting, we have got Tanya. Melissa is also our peer mentor at Uniting, but isn't here today. So we have Tanya there as our peer lead there. And at Wellways, we have here today Jackie. Hi, Jackie. Welcome. Alan is also at Wellways, but is not here today. So what will we talk about? What the pilot placement program is, what the centralised application process is and how it looks and how you use it. And then each placement provider or partner organisation will give an overview of their placement program. We'll talk about readiness to apply, how to apply, and also just so you know, so down the bottom you've got the little chat box there. If you've got any questions at all, please pop them in the chat. It will be moderated, so we will try to answer your questions through the session today. If there's any questions we don't get to today, what we will be doing is compiling all those questions and doing a bit of a Q&A document that will be sent out to everyone who's registered for the session today, along with this PowerPoint presentation. Okay, so what's the pilot placement program? So the pilot placement program supports students who are studying their Cert 4 in mental health peer work. So it's only for the mental health peer work certificate for. And it supports with the placement requirement. So typically that's 80 hours. I know at some RTOs that's 160. I think 40 hours is an offer for Hammond as well. And you get support from a peer coordinator and peer mentors on your placement. So that's that partnership that we have with our 5 placement provider organisations. They have dedicated peer coordinators and peer mentors trainers to help support you throughout your placement. You also get support from the Lived Experience Career Compass, so we can offer information and guidance on how to connect you in with the placement. And then also you are getting, the placement support to develop knowledge, skills and confidence in working in the lived experience peer workforce. It's a structured and supportive environment as well. So you're going into organisations where they have, a program there to support these placements. And also very easy centralised application process. So you can go in, just do one application, and then you don't have to keep sort of reapplying to different organisations. You can just apply through the application process here, and then your application can go to one of the 5 organisations. Also, just to say that, so traditionally it would be up to sort of student with support from your RTO's placement coordinator to source your own placement. You can still do that, but the idea of this program is to just make that a little bit easier, so to give you access to 5 organisations that have a placement program happening, where you just apply the one time, but you can also do your own placement as well. So it doesn't, if you apply here, it doesn't mean you can't source your own placement if there's something else there that you're interested in. So eligibility requirements. You must be enrolled in the Certificate for Mental Health peer work. So not Certificate for Mental Health, but Certificate for Mental Health peer work. Have obtained approval from your placement coordinator at the RTO prior to doing the application. It's really important that they're aware that you're doing your application, because there are other things involved with a placement, like particular placement blocks that certain institutions, RTOs have. You must have lived or living experience of mental health challenges, so either consumer or family care. I'll also say AOD and harm reduction in there as well. So you must be working or wanting to work from one of those perspectives. There are mandatory units in your Cert 4 that you need to have completed before you can start your placement. So you need to have completed those units before you can commence placement. So your timing needs to be right there. You also need to have an employee working with children's check. Although at NEMI, you can use the volunteer working with children's check. The working with children's check does come with a cost for the employee one. However, if you're looking to work in the peer workforce, that is going to be something that pretty much every organisation is going to require. So you can look at it sort of like getting that organised right at the start. There are other requirements for the organisation beyond the working with children's check, but they differ. So we haven't put them all here. The information is all on our website as well, and I think when we chat with the each organisation in a moment, they'll be able to go through those requirements as well. So the centralised application process, there's a single point of entry, I guess, to apply for placements that are offered by the 5 providers. So your application is received by us here at the Lived Experience Career Compass, and it will be then taken to an allocations meeting where it is reviewed by placement providers. You have the opportunity on the application to give your preferences for organisations. So we look at that and try to honour those preferences as much as we can. And we do ask that you think about, and we'll go into this in more detail, but think about the organisation, where it would be a good fit for you, and other logistical things like location, can I get there? We do a rolling intake, so we review applications regularly, and placements are allocated sort of on a fortnightly basis. You'll be notified of a decision of placement within 4 weeks. So that's not a guaranteed placement. That is just that a particular, say you have a preference for an organisation, they have capacity to take your placement. Within 4 weeks, they'll get in touch with you and arrange time to invite you for an interview. Now, if you're successful from that interview, then they will make that formal offer of placement. And then if the placement provider, so your contact there, will ensure that all their internal organisational processes are followed, all the checks and requirements are met, and they'll do that alongside your placement coordinator at your RTO. It's really important that that communication is really strong, because there's requirements from the RTO that the placement provider needs to ensure they're meeting, and vice versa. So communication there is really important, which is why we say please ensure that your placement coordinator at your RTO is aware that you're applying here. It's a collaborative process. Next slide, please, Izzy. So here's a little flowchart of how it works. So before you apply, make sure your placement coordinator knows, make sure you meet all the eligibility requirements in order to apply. If you don't, feel free to reach out to your placement coordinator to discuss your options or how you can become eligible, what you need to do if you're unsure. Also, we can help you here at the LEC as well. So we've got our email address there. Feel free to reach out if you've got questions about it or anything to do with the process of the placement program. Yes, you're eligible to apply. So your placement coordinator approves your application. You go ahead, complete that application form. We receive your application here at the LEC. And then we take it to our allocations meeting, and it is allocated to a placement provider. Hopefully it'll be your preference as well. We try to really honour that. So at that point, then you will be notified, your RTO will be notified, the placement coordinator at your RTO, and the placement provider is obviously aware that that's been allocated to them. So the placement provider then will contact you for an interview. And also contact the RTO to let them know that they've offered you an interview and keep you up to date on how that's all going. And hopefully that all goes well and your placement's offered. So the placement provider will then ensure all the required documentation's provided and liaise with the placement coordinator at your RTO and ensure that all those checks and everything is done ready for a very nice, smooth transition into your placement. If the placement, if it's not the right fit or, that's not going to happen, then the placement provider will share the feedback and outcome to you, also to your RTO, and also to us as well. And then we encourage you then to have further conversations with your placement coordinator at your RTO about what other options you have at that point. But also at the LEC, we can offer some guidance around that as well. Thank you. So things to consider when applying. All the placement providers have different opportunities that vary across different environments. So have a listen here today. If you're not able to be here at the moment, please, this will be recorded and put on our website. So review this. And there is information as well on the website. So have a look, think about where's a good place for my placement, where do I align? They also, placement providers have different intake timeframes and they offer a mix of full-time and varying part-time placements. So again, something to just consider before applying. It's important to familiarise yourself with these opportunities and ensure you're applying for a suitable placement and are aware of individual provider requirements. Thanks, Izzy. Next slide. Thank you. So when you apply, you are required to upload a cover letter, your resume, and proof of enrolment in your Cert for Mental Health Peer Work in a PDF format, please. We have some guidelines on what to put in your cover letter. So just trying to really support writing a really good cover letter. And we do look at those letters. They do really inform the placement that's offered. So please take a little bit of time to do that. It's also a great experience for when you're actually applying for permanent roles in the future as well. Placements are unpaid. So just to clarify that, that's sometimes a question. So these placements form part of your completion of your Cert 4. They are not paid placements. And think about location. So where is the site that you're going to do your placement? Where is it located? Can you get there? And think about all your other requirements and responsibilities and commitments in your life. So think about the days you could do placement. That might be only part-time for some people. Some people might be able to do full-time. So, and we also just wanted to have a really quick chat about using AI to write cover letters and applications. So we understand it's a tool that's out there. And look, we're all for getting support in terms of structuring, things, or if you're not too sure about how to structure a letter, certainly AI can be really helpful there. But we really want to hear your voice. So we don't want AI to write the letter for you. The cover letter is your chance to share what's meaningful to you, and it's something that AI can't do on your behalf. And we can often tell when AI has written a letter, and that we want to hear from you. That's what we're wanting to hear. That's a big part of, what you bring into lived experience work. It's yourself and your experience and expertise. So we do, as I mentioned before, we have a cover letter guideline document to help get you started. And we're not looking for perfection. We're looking for honesty, reflection, and authenticity in that letter. So AI can be helpful for support, so to help organise your thoughts or check clarity or tidy up wording, but please write the letter yourself. That's what we want to hear. We want to hear from you. So your own words and lived experience matter. They're powerful and they help us understand you, not just your application. So thank you, Izzy. Okay, enough from me talking a lot. We will pass over to Ben, who is here to have a chat about the Eastern Health placements.
Hi, everyone. Can everyone hear me? Great. Cool. So, yeah, my name's Ben. I use he, him pronouns. I've been at Eastern Health for about 3 years, besides a short stint with the lovely Tanya at Uniting last year. So I'm just going to run you through some of how placement works at Eastern Health. So next slide, thank you. So there's a lot of words on here. There's a lot of words in this document, but I'll just highlight some of the key things. So our lived experience team at Eastern Health is pretty well established. It's been around for quite a long time. It started off as providing post-discharge support. So when people were leaving inpatient units, we would be their social connection to help people as they transition back into the community. But since then, as you can see, we've been embedded in a whole bunch of different departments. So from the emergency department, CAT teams, inpatient units, obviously, early psychosis teams, all the way down to those like more community-based spaces like Park and CCU. Um, so yeah, if you are going to be completing placement here, most likely you are going to be in one of those inpatient spaces, or at least that's what it's looked like so far. But there's certainly opportunities to for example, be in the early psychosis team, or at a Park or a CCU. Um, Great, thank you so much. All right. So again, there's a lot, there's a lot of text here, but this is basically just to say that across your placement at Eastern Health, um, we we offer placement to both carer peer support workers and consumer peer support worker students. So basically, every week, what we aim to have you be doing is to be spending 2 days on site. So 2 days within your whichever site you end up at, and usually a day back in the office. And that's an opportunity for us to support people as they're kind of getting used to that clinical space, because sometimes that you can find there's a difference between what you're learning at TAFE and then when you're out kind of in a clinical space. There can be kind of differences in how things work. So we offer a way to kind of support you in that process. Um, and then in addition to that, we have presentations from some of our teams that work with Eastern Health. So we have people coming in from Turning Point, so the dual diagnosis or integrated care team, and then we have um, the FAPME people coming in as well. Um, Great. Next slide. Cool. So these stats just talk about what placement is looking like for us as a team. We have a strong priority on hiring people who've completed placement at like through this program. So as you can see there, 57% of students secure a paid role at Eastern Health after completing placement, and roughly 90% of students will successfully complete their placement while here. Obviously, life happens sometimes. There's different reasons that people might choose to drop out, but yeah, pretty good completion rate. Cool. This just basically outlines if you do end up with Eastern Health as a staff member moving forward. This basically just outlines the classifications that we utilize. So we hire people at level 2, and then that goes all the way up to level 6. So associate program director, lived experience. So there's a lot of room for growth. And that's certainly something that we really prioritize is setting our staff up to move into leadership if that is what they want to do. Great. Cool. So with Eastern Health, we do have a few different requirements than what was outlined just before, but there's a lot of crossover. Obviously, we want to have people with a lived experience perspective and a lived experience lens, and that can be from a consumer or a carer perspective. We have to have we ask that you complete the working with children check. We do also ask that you complete a national police check. These things are tax deductible, even when there are costs associated with them. The other key thing to be mindful of with us, because of the fact that we are sometimes in a hospital setting, we do need you to complete like or show that you've completed vaccinations. And the big one that kind of sometimes people get caught up with is Hep B, just because there's sometimes, well, there is it's kind of a long process. So it takes about 2 months to complete the process. So if Eastern Health is a place that you're interested in applying at, I would encourage you to start looking into your vaccination and serology history, just to make sure that we're not kind of bumping into any issues. Yeah. So this is the process of applying. Most of it's been covered already. But once we receive your application, we're asking that you're completing those checks. We then have a pretty informal interview with myself and Eleanor and Zoe. Then there's those background things like completing training, which you do online, that vaccination and serology piece that I just touched on, and we also we need students to do a mask fitting, which is through Eastern Health. Yep, then students come on board and they complete placement at Eastern Health. That's kind of it. But yeah, I guess the other things that I wanted to highlight as well is that in terms of timelines, we are at the moment, unfortunately, only offering placements for Box Hill and Swinburne students. So the dates that we have for Box Hill, the placements are starting on June 1st and November 30th. And Swinburne, it would be July 6th and December 7th. So if you are thinking about applying, just keeping those dates in mind and getting some of these things in motion, especially around serology and vaccination. Yeah, and I guess also just to touch on some of the things that we do outside of that input, that consumer-facing work is we do offer training and debriefing time. So yeah, feel free to email me or Mind, and they'll pass on any questions. Cool, great.
Awesome. Thanks for that, Ben. Okay, so now we'll pass over to Danny from Nehemiah. Thanks, Danny.
Thanks, Lisa. Hi, everyone. I'm Danny Spowett. I use she, her pronouns, and I'm the peer placement coordinator at Nehemiah National. So support's on offer for students and their peer mentors. So my role as the peer placement coordinator involves all aspects of coordinating your placement. I will also organise peer mentor and student allocation to services, and we're usually guided by your preferences that you submit in your applications. The peer mentors also receive supervision and support from myself as well as part of being the peer placement coordinator. Peer mentors provide assignment of the daily tasks when you're on placement. So you'll be shadowing, you'll do a variety of sitting into appointments. You might have opportunities to sit into group spaces. They also support you with daily check-ins and informal support as well, and you'll have supervision sessions with them also. The local team on site, so they will support you with site orientation, so you get familiar with the service and provide other supports as well. So across the team at your site, you may be able to participate in team meetings, you might be able to sit into training. We also have co-reflection spaces and an opportunity to learn how to work across a multidisciplinary team. So, where could you be placed? So, NEMI have many sites across both metro and regional Victoria, and we offer various different programs as well. So, we're working with the following sites to offer placement opportunities. So, we have Medicare Mental Health and Step Through Care programs in Geelong. We have the Mental Health and Wellbeing Locals, which we have 3 sites now. So we have Whittlesea, we have Latrobe based in Morwell, Regional Vic, and we have Darebin that's only recently opened. So they're not quite ready for placements yet, but in the coming months, they'll be ready to take on students. We also have youth residential recovery and outreach programs across the east and southeast of Melbourne. So those sites are located at Hawthorn, Noble Park, Seaford, and Moorabbin. We also have psychosocial outreach programs in the northern suburbs as well as the eastern suburbs. So they are in Thomastown, Broadmeadows, Glen Waverley, and Boronia. Placement opportunities will depend on the site capacity and if we have a mentor available. So please do make sure that you indicate on your application your preferences, and we'll try to accommodate that as much as possible when we coordinate your placement. So what you'll be doing. So placements are generally offered part-time. However, we can accommodate full-time placements and we can negotiate that depending on the site availability and if we have a mentor available full-time as well. We have quite a lot of mentors that work part-time, but there are occasional opportunities for full-time as well. So students are assigned a peer mentor to shadow during the placement, and some of the day-to-day activities, I've touched on it before, but observing day-to-day peer work, such as in-reach appointments, you might go on to outreach appointments, you might be sitting on in intake. There's also opportunities to attend multidisciplinary team meetings, engaging with consumers individually and groups. A lot of our services offer groups, so that's a nice place to sit into if you get the opportunity. You also learn about documentation, record keeping, reflection, debriefing as well. It's the student's responsibility to stay on top of learning goals and present that to the peer mentor to work through and sign off. So they'll support you with that as well. Compliance documents for placement at NEMI. So we do require you to complete a national police check, which we complete via Fit to Work. We send you out a link. You can fill it all out yourself and attach your ID documents. The ID documents required for that will be a birth certificate or passport, and usually a driver's license as well. If you need support lodging a police check, you can also send the documents through to me and I can submit it with our PCC team and they'll process that on your behalf. We also require a working with children's check. We do accept volunteer checks. However, as Lisa touched on before, if you do wish to work in the field, it is recommended that you get an employee working with children's check if possible. And there are no vaccination requirements for NEMI placements. So just to refer back to the Mind website, the pilot placement program for further information on NEMI. But if you do wish to contact me, if you've got any questions about NEMI, you're welcome to email me at peerstudentplacements@neminational.org.au. Thanks.
Thanks so much for that, Danny. Okay, so we'll move over now to hear from Darby at Origin. Thanks, Darby.
Hi, good morning. My name is Darby. I work for Origin Recovery. Apologies in advance. I do have a cold, so hopefully I'm relatively right on cue. There we go. So hopefully I'm relatively clear going through this, but I may need to stop at some point to cough. So, fabulous. So Origin is a youth service, and our peer placement program is a part-time placement, usually covering the 80 hours that are required from most RTOs, but we are flexible if you require more or sometimes less. So we have what we have available is the Origin Y Park, which we will talk about in more detail in a little bit, and also one of our five Origin Headspace centers. So, Origin's placement program is ideal for peer workers looking to work in youth mental health services and students interested in youth peer work. So, much like the other placements, students will have the opportunity to shadow experienced peer workers during their placements and receive support and consumer perspective supervision from the peer work placement coordinator, which is myself. Students will work within a multidisciplinary team and engage with peer support activities on sites, such as group facilitation, shadowing one-on-one peer support, and participate in handovers and clinical reviews. Next slide, please. Lovely. So, Y Park. Sorry, I will need to update this slide at some point. Because Y Park is no longer part of Origin Recovery. It's part of Parkville Youth Mental Health Services, but we do still fall under Origin. So, just a heads up, it is not exclusively the domain of Origin Recovery anymore. So that is it's a youth mental health service designed for and with young people aged between 16 and 25. So it provides services to young people all across Victoria who are experiencing mental ill health. Origin Recovery fills an important gap between community services and acute mental health services. So it's a community-based residential facility that provides a short-term, step up from the community for a young person to work on recovery goals or to prevent an admission to hospital, or a step down from a hospital to further assist with recovery and safe transition home. So that Lovely. And we also have, thank you, sorry. Uh, can we go back to the Y Park, please? Sorry. Can we, thank you. So the Y Park, at Parkville has a really strong comprehensive group program and three youth peer workers who are great, including Millie, who is our sort of lead who is our lead peer coordinator for the Y Park as well. We're all very involved with our placement student there, and there are a lot of opportunities to get involved not only with their group program but with the recovery goals of the young people who are staying at the Y Park. So they'll usually be there for about 3 weeks. The sort of cap is 28 days. So yeah, that is actually a really good opportunity to meet with people sort of, whilst they're staying there and sort of organically connect with them. So next slide, please. So, Origin Headspace, we have five Headspace centres in the northwest of Melbourne. We are located in Craigieburn, Glenroy, Melton, Sunshine, and Werribee. And also, very exciting, it's just been announced that a sixth Headspace will open in Moonee Valley later this year. So, it'll probably be a while before they're ready to have student placements, but keep an eye out. So, Headspaces provide early intervention mental health services for young people between the ages of 12 and 25. Can we hold that slide, please? So during your time there, each headspace is different. They have a different sort of operation. They have different group programs. They have different ways of doing sort of peer support. So that'll look very different from a headspace, obviously. So there'll be a lot of opportunities for phone work, shadowing, shadowing one-on-one peer spaces, and also uh, co-facilitating and attending their group programs. As I said, each of them are quite different. Werribee has like a really great First Nations specific peer program as well. So if there are any First Nations peer workers out there, I think Werribee could be a really great place to go and receive mentorship as well. If you want a more sort of specific, if you want that sort of more specific perspective. The First Nations peer worker only works within the First Nations community as well. Melton as well has a really strong trans and gender diverse specific group as well, with a really strong focus on music as well. So again, for anyone who wants that more sort of specific perspective, can definitely reach out about coordinating placements in those areas. Next slide, please. So what we need from you, unfortunately, we are only able to accept placement students under the age of 30. Um, yes, we have had people reach out who are sort of over those ages about placements there because it is convenient for them in terms of like where they're located. But no, unfortunately, we can't accommodate that because you're working so closely with young people. We do need that youth perspective, unfortunately, or fortunately, depending on how you look at it. So we also need evidence or written approval for you to undertake your placement from your education provider. We'll need to do a provision of a placement agreement between the RTO, ourselves, and you. A valid working with children's check and a current national police check. And also because you're working within a residential setting, a proof of COVID-19 vaccination. Next slide, please. So what we offer. So we offer orientation prior to starting placement, which will involve introduction to the organization and contextualizing their studies within the placement environment. Students will be supported to understand Origin's approach to peer work, introduced to key concepts of youth mental health, and the YPark model and the Headspace model, and initial co-reflection about the placement itself. Regular supervision with peer placement coordinator, usually once a week. But I'm also usually pretty hands-on as well and, available for check-ins or any sort of co-reflection sort of as needed. Also, senior peer support workers within each of the organizations have regular co-reflections within their own teams. And yeah, and also a very person-centered placement focused on your development as a peer support worker, focusing on your unique strengths and areas in which you wish to develop. I am more than happy to tailor the placement to the individual. We've had a lot of people come in with different sort of knowledge about the work and different areas of interest. And yeah, we've really done our best to create a really sort of singular learning experience. Next slide, please. Yeah, and here are just my contact details. Yeah, reach out to me whenever you like. Yeah, so just regarding the Headspace placements as well, we've tried a number of different approaches with the Headspace placements, and we've found that the best way is if people are looking for a specific placement based on location for the Headspaces, is to reach out to me, and then I can uh, liaise with the various headspaces about their availability, as opposed to sort of setting up a strict time. For example, having Craigieburn available in June only, and having no one available. So we're going to try that approach sort of moving forward. So for example, if you're looking for example, a Melton placement in November of like next year, even if you're not ready for placement, please do reach out and discuss that, and we can look at how we might coordinate that in a couple of months' time. And it gives us time just to sort of make sure people are available and sort of set that place aside. So thank you very much.
Thank you so much, Darby. Okay. Now we're going to pass over to Tanya from Uniting Victims. Thank you.
Thanks so much, Lisa. Hi, everybody. My name is Tanya Wall. My pronouns are she, her, and I am the lead educator for the Peer Pilot Placement Program at Uniting. So our purpose, we work to inspire people, enliven communities and confront injustice. And then in terms of values, we challenge convention, explore new possibilities and dare to dream with imaginative process. Respectful, we act with honesty, integrity and open our hearts to all people without exception. We are also compassionate. We are nurturing, generous and thoughtful in our words and deeds. And bold, we face injustice head on, standing up for what is right and true with confidence and strength. So they're a bit about our values. We work alongside a whole cohort of different people, people generally who want to work on their mental health recovery, who may need safe and secure housing, who want to gain control over their AOD use, who want support through counselling, mentoring and life skills to work towards their life goals, who are caring for someone needing advice and support so they are better able to care for themselves. We also have family groups to provide parenting support. We provide support for those who are newly arrived to Australia or Victoria and needing a safe and welcoming community. And also we have a lot of early learning centres scattered throughout Victoria. So we've got those environments as well. The requirements to secure a placement with Uniting. So there's a 1.5 hour group interview. That's to ensure you are familiar with both the working space and the opportunities offered as at Uniting, as well as ensuring we are the right fit for you, and obviously you are the right fit for Uniting. You are needing to obtain a free volunteer working with children check, but as Lisa mentioned before, a paid check goes a long way as well and is obviously something you will need moving forward. So that's the preference. Obtain a clear and valid police check, which is actually paid for by Uniting. You are required to complete mandatory onboarding modules before your start date, and obviously there are no mandatory requirements for vaccinations or immunisations to work with Uniting, as we're not a clinical space, we're a community-based space. To work with Uniting, you will commence a 4-week placement with us, working every Monday, Tuesday and Wednesday from 8:30 to 4:30. That holds to 15-minute breaks and a 30-minute lunch break. And our Cert 4 mental health peer work students will be mainly located at both our Paran and St Kilda sites. Both sites are very, very centrally located, close to all PT. So yeah, very, very easy to get to, which is great. What you can expect on placement with Uniting. So we offer students the opportunity to learn the ropes of mental health peer work with a sector expert, our student placement peer work trainer, who will provide both experiential and theory-based learning, such as an overview of the intentional peer support framework and the hearing voices framework, with support and guidance throughout your placement. Students will have access to consumer groups within our service, along with supervision and co-reflective spaces with your student cohort. So that whole time you're working obviously with the students that you're placed with, which is great. And then, as I say, there's obviously opportunity to work across group work, etc. So some good exposure there to our consumers. Next slide, please. So far, Uniting has had a number of students complete their 80-hour placement, and the feedback to date has been really positive. But we've actually had some students share some great ideas in their exit interview to help strengthen and improve the program and make it the best possible experience for everyone. So obviously we listened to that feedback, and as such, we've decided to change things up a little bit, add a bit of spice, and add a whole new dimension to our peer pilot placement program. This is a really exciting opportunity which will be available to all future students undertaking their placement with us. But sadly, I've got the mouth taped. I can't give away too much just yet. Next slide, please. So you need to stay tuned for something awesome. As we finalise all the details and ensure we have dotted our I's and crossed our T's, we'll be actually sending some more information to your RTO in the coming weeks, so please keep an eye out for it, and that will have more details of what Uniting's offerings are in terms of future placements. But obviously it will be predominantly those group settings, consumer one-on-one work, and you'll be working under the support of a very, very well based trainer. A question's come up from Steve. Being a church-based organisation, are we LGBTIQ friendly? We absolutely are, and a number of my peers and colleagues at work are within that cohort. So there is absolutely no discrimination judgment against our LGBTIQA plus cohort. We invite all from that area. So no worries, Steve. For further information, please contact myself. Obviously going through the steps with Mind, but if you do want to reach out, feel free to email me directly. Thanks so much.
Thanks for that, Tanya. That's wonderful. We're excited to learn more in the coming weeks. Thank you. I'll pass over to Jackie from Wellways. Thanks, Jackie.
Hi, my name's Jackie Collins. I use she, her pronouns, and I'm the senior peer mentor for Wellways. Yeah, next slide, please. So I'll just give you a brief overview of Wellways. So Wellways was established in 1978, and it was established through families and carers wanting to improve services and information and support for people experiencing mental health issues. So from the beginning, lived experience was embedded in what we did, and we continue to strive to keep that at the heart of all we do. So, oh, this slide's colours are quite bad. I apologise for that. So the lived experience workforce, we have consumer and care peer support workers as part of all of our mental health services across Australia. They're embedded in all levels of the organisation. Currently, and this may have increased already, we have 163 lived and living experience workers in Victoria, and this is growing consistently. Previous peer work students have obtained jobs in both our parks and mental health and wellbeing locals following completion of their studies as part of their placement and also in cadetships. Okay, so it looks like a slide was missing. So I'll just speak to this. Apologies for that. So Wellways has an initiative called Peer Hub, and we're going to have a hub set up at one of Melbourne's universities where students and senior peer workers will provide support within that university community. We're in the process of doing that, but until then, we have got many other opportunities available to support people in their placements. Okay, so some of those other opportunities that we have, which give a really good grounding in the opportunities that are out there. So we have our parks, the prevention and recovery care, which is a voluntary short-term residential support program, and it's run in partnership with local area mental health providers. And this gives a great opportunity to work within a multidisciplinary team and within a residential space. We also have our mental health and wellbeing locals, which provide free support one-on-one and groups for people who are experiencing challenges with substance use and or their mental health. And peer navigators actually lead the intake and navigation processes, as well as offering one-on-one peer support. And they're located across both metro and regional Victoria. And the other opportunity we have is Listen Well, which is a warm line, which is peer-led by volunteers. And it's an opportunity where people in the community can phone and receive information, support and referrals. And that's for people experiencing their own mental health challenges and also for family, friends, carers, loved ones. So that also gives a really well-rounded opportunity to experience a variety of peer support places. So we provide discipline-specific supervision, so consumer and carer supervision. We provide regular co-reflection spaces, ongoing mentoring and flexibility in what placements look like, depending on our capacity and location. We're also able to provide regional placements. Thanks. So as a team, we've had many years experiencing and supporting participants, fellow peer workers and peer trainees, and we'll be looking forward to supporting you in your journey. And I just want to give an overview of the placement, because my apologies, I'll send out new slides because it seems like a few of them are missing in here. And so our placements are across 6 weeks. That's 2 days per week. And so we offer a really supportive induction period, and that you will do with other students. Following that, you'll be placed at one of our locations and you'll have access to the staff there. You'll also have your peer mentor, and we provide supervision at least twice during your placement, and we also provide weekly co-reflection with your peers. And within that as well, you'll also have the opportunity to speak to and get to know the dynamics working within the multidisciplinary team. Okay, so Steve, sorry, I'll answer that. So we do a rolling intake. So because we place across a number of different sites, we don't have set intake periods. So if you, in your applications, pop in when you're able to commence, when we have our phone catch up, we'll look at what your availability is and we'll try and coordinate a group to commence at the same time. At times, we can also provide the opportunity, for one person to go through their placement or just a couple. So we're very flexible in trying to meet the needs of students coming through. So yeah, whenever you're ready, please let us know and we'll support that placement. One of the things that's different with us, which can cause a few issues occasionally for people, so I just want to highlight it, is we do require the NDIS screening check, and that does come with a cost. It is tax deductible, but that if you're keen on a placement with Wellways, we will require that, and occasionally it can take a little bit of time, and also just being totally aware that everyone has different financial situations. Unfortunately, we're not able to help with that, but maybe with the knowledge that that's going to be required, just sort of think about that sort of planning when you're putting in your application. Thank you, and apologies for the lack of slides.
No, thank you, Jackie. That was great. Appreciate it. Thank you. All right, that is the conclusion of our information session today for the student placement program. We have a little QR code on screen that you can scan in with your mobile device. We would love your feedback. So if you could do that, that would be great. And just a reminder that everyone who is registered for the session today, and those who haven't attended, will be emailed the recording of this session. It'll also be available on our webpage in the coming week. We'll also be emailing these slides out to everyone who's registered. So big thank you to all our panelists, presenters today from all our partner organisations. Thank you so much. And thank you to everyone who's attended, and have a great rest of your day.